Eric Hammer here, registered physiotherapist. Today I'd like to talk to you about a fairly common lower extremity hockey injury, and that's referred to as an ankle fracture, and sort of the rehab process that goes about when somebody has an ankle fracture. So what I'll see sometimes, and these are one of the more traumatic injuries in hockey, is if a patient, for example, if they're skating, perhaps they go into the boards and their skate might get caught on an edge or something of that nature, and essentially what will happen is the skate will stop and the body will turn over the ankle, and they'll actually fracture the bone, typically in either the tibia or the fibula or both. And the bones will essentially fracture, and there's different kinds of ankle fractures that can come about as a result of this. You can have a displaced or a non-displaced fracture, and so what I mean by that is when a fracture is displaced, there's an actual separation of the bone, versus a non-displaced fracture where the bones are essentially in line, but you have a crack along where the fracture is in the bones. Now, depending on what type of fracture you have, the rehab or the techniques that we use might be different. So, for example, with a non-displaced fracture, in a lot of cases, the patient will have to have a pin or a plate put in place to actually line up the bones appropriately again, versus a non-displaced, the patient might just be cast initially, and then after a period of typically 6 to 8 weeks, we would then begin a rehab process. Typically, if somebody's has a pin or plate in, that rehab process can be started earlier because they have more support initially as a result of having a pin in place. So typically there's different stages to how we want to rehab this type of injury. Number one, after somebody's been in a cast or immobile for a certain period of time, the ankle is going to be quite tight and restricted. So initially we want to try and actually regain some range of motion. So there's different techniques to do this. One is very specific exercises to be given. Another thing is some form of hands-on treatment. So whether that's some mobilization or soft tissue work, acupuncture as well can be beneficial in terms of relaxing some of the trigger points or the tightness in the muscles as a result of being immobile. And then again, soft tissue work as I described, and some of the hands-on approaches. So typically that's kind of goal one coming out of the cast, is to regain some form of, or regain as quickly and as much as possible, your full range of motion. Now, depending on if somebody is weight bearing or non-weight bearing after, other areas we'd want to work on is proper gait pattern, proper ways to accept weight onto that side if the patient's able to fully weight bear. So one thing that'll happen is if we're not, or if we're in a cast, or if we're having to use crutches, well, all of a sudden our gait pattern is going to be affected. The other side as well, the non-affected side, there might be some discomfort, some pain there as a result of having to accept all your weight on that side over that extended period of time. The next thing we'd want to do is actually work on strengthening the muscles that cross the ankle joint. So what'll happen again as a result of being immobile, there'll be some atrophy in the different muscles that cross the ankle joint. So this would include your gastroc muscle, which is your calf muscle essentially, the tibialis anterior, which is the muscle in the front of the shin, your peroneal muscle, which is one of the muscles that goes on the outer portion, so to speak, of the tibia and fibula. And so the idea with this is to build up the strength to support the ankle. This would also include some form of balancing, right? Balancing and proprioception. So these different areas, they also get influenced as a result of, one, the trauma involved, and also the result of not weight bearing and not having pressure on that area over an extended period of time. So these again are going to be areas we're going to want to really work on and isolate before we go into much more activity-specific exercises, which would include things you need specifically for, in this case, hockey, right? So pushing off, directional changes, the ability to accept weight quickly, and also the ability to have some form of impact on the ankle now, changing direction. So all the things that are required with regards to skating, starting, stopping, as I mentioned, pushing off, the ability to skate both forwards, backwards, laterally. So there's a lot involved. Once we have the strength and mobility back, that's going to be much more sports specific in terms of treating this ankle injury and getting the player back on the ice as quickly as possible. If you have any questions or concerns, please feel free to leave a comment below. And also, if I can be of any more support for you with regards to this particular condition, if you're suffering from this, also feel free to send me an email to ask any more specific questions for me. My email is erichammertherapy@gmail.com. And have a great day. Take care. Thanks again.